Hi, everybody, and welcome. It's Friday, so it must be Kinetics USA weekly show, Onwards and Upwards. Everything that a global nurse needs to know about living and working in the United States. And my name is Tanya Friedman. I'm joined today by Nikki. Hi, Nikki. Welcome. Linda. Hi, Linda. Linda, we don't hear you.
Oh, sorry. I had muted my mic. Hi, everybody.
That's okay. Welcome, Linda. We
Thank
also
you.
have Jill joining us. Hi, Jill.
Hi.
Jameson. Hi, Jameson.
Hi, everyone.
And Christine. We have a full house today, everybody. Today's topic is going to be about how Kinetics matches global nurses to US employers. And for all the nurses who are watching, thousands of nurses who watch our show every week all over the world, today is the day because we have the inside scoop. We're going to be hearing from an American employer, Methodist Bonheur, and we're going to be hearing about what they look for from a global nurse and what they also have to offer global nurses. We're going to be talking about the area. So we're going to be talking about Tennessee. We're going to be talking about the hospital system. We're going to be talking about the International Nurse Program. We're going to be talking about their education and training. We're going to be talking about growth opportunities. So lots to talk about, and we're going to get stuck in. And before we get started, I want to welcome everybody who's watching around the world. Please put into the chat your name and where you're watching from. I see we have Sri Ranjit, we have Sidhu who's asking about H1 options. So Sidhu, we're going to answer that question. We also have MD Farouk. We have who else is putting their name here? Oh, lots of people. Apu's asking about studying for the Nclex exam. So Apu, please stay tuned. And also, please, everybody stay tuned until the end of the show because we're going to be announcing our Ielts Scholarship winner today. We have, let me see. Suman is saying hi. Belanli is saying hi. Lots of people from all over the world. So let's get started. Okay. So let's start off with some introductions. If each of the guests want to just tell us a little bit about yourself. Let's start with Nikki.
Hello, everybody. Thank you so much for joining us today. I'm very, very excited to have the opportunity to talk to you about Methodist Bonheur Healthcare as a great place to work, as a place that you can grow professionally, and to talk about the community that we live in, which is really a wonderful place to live. So looking forward to our time together, and please ask your questions so we can answer them for you. And we'll give you some information too that'll help you get to know us better.
Absolutely. And we love that Methodists are doing the show. As I said, this is an inside scoop for all global nurses to know what an American hospital is looking for and what they have to offer. Jill, do you want to go ahead and introduce yourself and tell us a little bit about your background?
Yes, I'm Jill Lopez. I'm the Director of Recruitment here at Methodist Bonheur, and I am so thrilled to be here with you all. I'm first generation in the U.S. here from my family, so I'm excited to be part of this great international guidance and showcase, and been working here for a little over 6 months and loving it.
Okay, well, thank you so much for joining us, Jill. Where were your family from?
My dad's family is from Lebanon, and my mom's family is from Poland, Russia area.
Wow. Okay, real cool. So, I'm just looking in the chat. We've got people telling us where they're from, and
nice.
we like the United Nations here. We've got Liz is from Brazil, Rommel from Philippines, Jen from Oman, Marlon from Jamaica. Elman from Dubai, Safir from, he's a medical technologist. So lots of people, Sumi from India. Linda, do you want to tell us a little bit about yourself and your background?
Hi, my name is Linda. So I'm originally from Malawi. That's a small country in the eastern part of Africa. But this time I came straight from South Africa, so I was working in South Africa. I started nursing right here in the States some time back in Indiana. So I got my license from Indiana University. I mean, my nursing degree from Indiana University, but I was just a student and young. So I went back home to Africa for about 12, 13 years. So I just came back last year.
Okay, thanks, Linda. And we can't wait to hear more about your journey and your experience. And of course, very dear to my heart, Linda worked in South Africa and I was an immigrant myself. I came originally from South Africa, and I see we have some South African nurses in the chat as well. So welcome. Marinette is from South Africa, soon to be part of Methodist. Very excited. Welcome, Marinette. Okay, Jameson.
Hello, good morning, everyone. My name is Jameson Hardaleza, and I'm from the Philippines. But before coming here in the United States, I live and work in Abu Dhabi, United Arab Emirates.
Okay, thank you, Jameson. And I see we have a lot of nurses from the Philippines that are joining, so I'm sure they're going to be very interested to hear more about your story. Christine, last but not least, tell us about yourself.
Hi, everybody. My name is Christine Crook-Clancy, and I am the Director for Nurse Residency and Recruitment here at Methodist Bonheur Healthcare in Tennessee. And I'm excited to be here today, too. I have been working for this health system for about 2 years now. I came from Iowa, another state in the Midwest of the country, and I moved a little bit further south to have nicer weather and to be working for a fabulous health system that I am truly grateful for. So excited to be here today and share with you what I love about our organization and what I love about nursing.
Okay, thank you, Christine. And I think that'll also be an interesting perspective. And you spoke about going further south. So we're going to start off today by talking specifically about where Methodist is located. Let's talk about Tennessee. Okay, so for many international nurses, you know, they might know where California is or Florida is or Texas is, New York, but not really very much. A lot of people don't know that much about Tennessee. And Nikki, can you tell us what Tennessee is like? And we can see on the map where it's located. Nikki? Oh, you're on mute, Nikki. Okay.
Sorry.
No, that's okay.
Tanya said we didn't need to be perfect, so I just did my imperfect thing.
This is a live show, Nikki, and this is, I think, why nurses love this show, because we all just very real.
So one of the things that I really love about Tennessee is that there is so much within our state to do. It is so diverse. So we have the mountains in the east part of the state. We have a lot of music in central and in the western part of the state, which is where we're located. So it's a very, very diverse state just geographically. It's also a very, very diverse area from religious perspective, from ethnic perspective, racial perspective. And so I think that's one of the cool things you can see by the way it's shaped. It's a long state. And so we do have, it could be when you look at where we are, which is really in the western part of the state, one of the really cool things that I think you can see from here is how close we are to Arkansas and to Mississippi. And we're really right there on the border where we are a river town. So we're on the Mississippi. I happen to live downtown, and I actually can walk to Arkansas, and I have across the Mississippi River. So I love that the location is just so great. And overall, we still have the 4 seasons, which I love, but they're much, much milder. Beautiful, beautiful springs, very nice falls, milder winters, and then a great summer. So I love all of that diversity that we have in our community.
Okay, well, thank you for sharing. That actually gives us a lot of insight into the state. In fact, it was kind of interesting. I didn't know this, but Tennessee was ranked 3rd on the U-Haul Growth Index in 2021, which means it was the 3rd most common state, or the third state, third most populous state for Americans to move to in last year. And I think they're in the top 10 in 2020 as well.
And I think as we talk today, you'll really see in our area, for example, it's very international. So we have FedEx is here. It used to be Federal Express. FedEx now is here, which is a very international company. We have International Paper here, again, international. We have St. Jude. Many of you may have heard of St. Jude, where people literally come all over the world to get care for their children, but it's also a research hospital, and they go all over the world doing research. So again, we have a lot of things in our community that are international, but it's a great place because there's something here for everywhere. Great healthcare, a lot of culture here, and again, as I said, just the diversity piece. And so I think it is a very attractive place to come. And I think later on we'll talk about some of the things that make it a great place to live, that make it very livable.
Absolutely. Well, lots of good stuff. Linda, did you know much about Tennessee before you moved there? You're on mute. You're on mute, Linda.
I'm sorry. No, not really. I knew about Martin Luther being assassinated here, and Graceland, Elvis Presley.
Oh,
That's
cool.
all I knew about.
There you go. Everyone knows
And
that
those
one.
are the two places I visited when I got here. So, yeah.
We like you knowing Graceland better, Linda, but
Yeah.
actually we do have a museum here that honors
The civil rights.
that whole piece of civil rights, and
Correct.
it's fantastic. So a lot of things like that to do here. So
Definitely a lot to see and do.
Yep.
And Linda, what do you like about living in Tennessee?
It's the cost of living.
Uh-huh.
So compared to a friend of mine that stays in New York, I find it very. I even wonder how do they cope? I mean, she can't drive because the parking in Manhattan is just way too expensive. So it's the cost of living that I love the most about this place. We park. We still have free parking in most places where you can just go and park your car for free. And accommodation is not really bad. I live in one of a little bit high because of the school system with my kids, but it's still affordable.
Yeah. And that makes a big difference. I mean, I live in California, and there are many states where they're wonderful places to live, but it can be very expensive. So for an international nurse coming to the United States for the first time, going to a place that's got everything that Tennessee's got to offer, but also affordable with a reasonable cost of living, it makes it very, very attractive.
Sure.
Linda, one thing I know that you had mentioned is that we don't have any income tax here, right?
Yes.
Yes, thank you. Thank you for mentioning that, Nikki. So
Yes,
that's
yes.
very important for international nurses to know as well. Jameson, when you came to Tennessee, what surprised you? Was there anything that surprised you that you didn't expect about the state?
It is about the weather, ma'am, because when I arrived here during winter of 2020, so it was really below freezing level. So I was not aware of it.
Okay.
So I really struggled walking. That's my really struggle that time. I didn't even know that it has 4 seasons.
Okay. So that's a good tip, and that's why we do the show Onwards and Upwards, because I think for many international nurses, they don't realize how different the weather can be in different parts of the United States. So it's really important to do your research before you get here to know what to expect. If you need to bring a coat and you need to keep warm, that's something that's very important to mention.
The nice thing about the weather here, I think, is that winter can get a little cold, but it's in very short bursts.
Exactly. That was just what I was about to say.
I came from Iowa and Nebraska, and I've lived in Minnesota, which are all upper Midwest. And we're talking months of below zero wind chills and cold weather there. Here we can get by with a couple of weeks, maybe a month, where we're kind of uncomfortable because of the cold, but it's actually pretty livable, I feel like, compared to other places.
It's all relative, Christine.
All relative. That is exactly right.
It's all relative. Okay, good. Thank you for mentioning that. Okay, Jill, can you tell us exactly where the hospital system is located in Tennessee and why you like living in that specific location in Tennessee?
Yes, well, we actually have about 6 hospitals around the general area that you can work at and work from, which is amazing. So we do try to make sure we're in communities where we're serving the patients that where they need to be. So we have, many of areas within Memphis, Tennessee, and the surrounding suburbs where we take care of patients and feel and be available for patients. So there is always a hospital there that we can place you at, and you can work and be the best you can be for our patients. We have a lot of group comfort in many of the suburbs. There's a lot of close proximity to the hospitals. The thing that attracted me about Memphis is that you can live in a suburb that's 5 minutes away from everything you need. So it's not like you have to go far to go anywhere, or far to find community, or far to find anything. In fact, what I was amazed is that within 3 to 4 minutes, I can find grocery stores that sell products of my generational background, and restaurants as well. So it's not just about being a place where you go to a hospital and you come from another international nation and come in, but you come where there's a community, where you're part of a family.
Okay, and we love that, part of the family. And I'm just looking in the chat, and I see that Priscilla is saying, my name is Priscilla, and I will work in Methodist Hospital starting this month. Yay.
Wonderful. Welcome.
She's from Brazil,
We're happy.
right?
Joining the family.
Priscilla, you're from Brazil, right?
Correct. She
Yes.
is.
Well, we're excited for you to come. Very excited.
And just so you guys know, we've been based in Memphis, Tennessee, and been caring for patients for over 100 years. I mean, well over 100 years. So, we have definitely been here for quite a long time and established ourselves within the community.
Okay, thank you, Jill. So, Christine, as you are welcoming Priscilla to the family, what would you say is your favorite thing about living in Tennessee or in the surrounding areas?
My favorite thing about living here, I think it's the amount of things that you can do, and the amount of things that you can get to easily to do, I guess I want to say. Like Jill said, if wherever you choose to live, you'll be within about 5 or 10 minutes of anything that you would actually need. But the nice thing is that you're pretty much within a half hour, 45 minutes of a lot of things to do. If you like the outdoors, if you like to go to museums, if you want to see, if you love music, we're a music city, so there's always lots going on with that. I just feel like one of my favorite things is that there's so much to choose from when you're looking at what you want to do. So there's not really a good reason to be bored around here unless you just choose to be.
Okay, so that's a choice too. You can choose to do nothing, but there's a lot to do if you choose to get involved.
That is so right, and that is really wonderful about this area. So, and it's year round. It's not just certain seasons that there's certain things going on. You can find things to do. Wintertime, one of the favorite things is like the zoo lights. Our Memphis Zoo and our botanical gardens both put up lots of Christmas lights and lots of things to do, music and things you can go walk around. And it's, Christmas time, it's winter time. But that's just an example of some of the when you can think of things to do in all seasons.
Fabulous. So lots to see, lots to do, lots to learn. And as I'm watching the chat, we're getting lots of questions. Agbani's asking, how do I join the Methodist Hospital?
Oh, great.
So Agbani, if you are interested, please go to the Kinetics USA website and put in your contact information to kineticsusa.com/application. And our recruiters, we call them career matchmakers, will be on standby to speak to you and see what your background is and see if this will be a good fit for you. So we're excited for you to apply.
Yes.
Okay, let's talk a little bit more specifically about the hospital system. Nikki, tell us, I know we've spoken a little bit about the hospital system, but tell us a little bit more about it, about the hospitals, and also about the unique culture, the power of one culture.
Sure. And I think we have some slides that might help with that.
Yeah, go ahead.
So one of the things that Jill talked about is that we really serve all corners of our community, and we're very proud of that. And so you can see on that map that's there that we have 6 facilities, and they really surround this area. Methodist University, and that's where Linda and Jameson work, is a hospital that has some special things that go on there. It is our hospital that does transplant, solid organ transplant, and they do the neurosciences there. So that's one of the things that are two of the things that are really unique about Methodist University is that those are the things where they specifically serve patients. Now they have all kinds of services. They have a medical and a surgical ICU. They have a CVICU for cardiac. They have med surg, they have step down, they have operative services, which is where Jameson works. So we have all of those things. So if you go back to the slide, really with the different hospitals would be great. Thank you. Our Methodist South Hospital, again, is in our South area. And that serves our community in the Whitehaven area, which is really right by Graceland. And again, they have all of those services, med surg, critical care, step down, operative services, a lot of procedural areas, and they have labor and delivery and NICU at that facility. You'll see our North Hospital, and you'll see that magnet banner. All of our hospitals are on the magnet journey, and I know many of you work in hospitals that are on magnet journeys or are magnet designated. And our Methodist North Hospital, which as it indicates is in the north part of the city, again, is our first community hospital in this area that was designated as a magnet hospital. Methodist Germantown, which is where Linda lives, and so does Jill. In that community, we have our Methodist Germantown Hospital. Again, they are on the journey for magnet, but they have one of the largest obstetrical services in the area. They have labor and delivery, they have antepartum, they have postpartum, they have a NICU, a level 3 NICU. Very, very busy operative services, including doing a lot of CV surgeries there. Methodist Olive Branch is the 5th hospital, which is in our system. It is actually in Mississippi, and it's our newest hospital. Again, they do med surg, step down, critical care. They have a very busy emergency department, and they have perinatal services there. So they have OB services there as well. And then we have, as I mentioned, 6 hospitals that surround the city. Our last hospital that I'm going to talk about is Bonheur Children's Hospital, again, magnet designated. And Bonheur and University are very close geographically. Bonheur is a 255-bed freestanding children's hospital, again, with a full range of services. They have a level 4 NICU, as an example, with 60 beds. They do heart transplants there, and they just did their 50th heart transplant there. And because of how important it is to serve this region, and we serve nationally as well, they are building on. So enhancing their cardiovascular and their NICU services by adding more rooms, more beds. Yep. So that really talks about our hospital system. We have another slide that I'm going to ask them to put up that really talks about kind of what sort of a compilation of all of our facilities and all of the services that we have. So we have 1,600 beds, but again, those are spread over those 6 hospitals. We have 12,000 associates. That's what we call our staff. We have 6 hospitals. I mentioned that. But we have other things as well in our community, and that's that we have physician office practices, we have diagnostic centers, and we have 69 of them. We have outpatient centers where we do surgery. We have post-acute care, home health equipment, home health services, so we do home nursing, and we have a residential hospice and a home hospice program. And I mention all of those because, again, one of the things that we're interested in having you do, and I talked about that in the beginning, is professionally grow with us, is you can see that we have a lot of opportunities, not only within our hospitals, which is where for the most part, our international nurses start. But as you develop your career, you may want to go to home care, as an example, or go work at our hospice. So that's really one of the value added benefits of working at a Methodist Le Bonheur Healthcare, is that you have a lot of opportunity to grow and a lot of places where you can contribute.
Wow, Nikki, that is so impressive. There's just so much opportunity for international nurses. And I'm just looking in the chat. Brenda's saying my dream place to work is Tennessee. Well, Brenda, come on over.
Come on over. Yeah.
All the opportunities for you. And then we've got Mike, who's saying, good day, everyone. I worked for 7 years in the operating room in the Philippines. Currently, I'm here in Germany. I passed my board exam here. I speak English and German. I'm an OR nurse here. I'm very interested to work in Tennessee in the future, and I'm planning to take my Nclex exam this year. Well, Mike, get that Nclex exam done because
yes.
you can see all the opportunity. And just to share with everybody, I've been to the hospital system a few times and met a lot of the nurses, and there is so much opportunity. I'm just thinking, as Nikki was speaking, of Helen, who is a South African nurse that I met at Methodist. Linda also knows Helen, and she came to Methodist, I think it was like 30 years ago. She came for a year and has stayed for 30 years. And has worked her way through lots of different opportunities all throughout the system. So, just so much opportunity in this organization.
And Tanya, you make a great point. When we started this international journey, we had 2 nurses from the Philippines that really were our mentors as we worked on this, because it was important to us that we do it well and that we let this community know how important they are to us. And one of them, Donna Guimera, is a manager in infection prevention at our children's hospital. Maria Kasing was one of our, has worked in a lot of our facilities doing a lot of different things, but was a manager in one of our cardiac programs. So again, they have really been able to advance and again contribute in so many different ways. So I love those examples that you give, because we do have within our workforce diversity. One of the nurses that we have that works with Helen is from Africa and from Nigeria, and is a senior director and is doing community services. So a lot of people here that are contributing in so many ways. And you talked about our Power of One culture, which is really about how each of us individually as one person can make a difference. And as one team, we make a difference. And as one organization, we make a difference. And I think those were great examples of people that are really contributing. And that, as nurses, there was a med tech on, whatever it is your field is, an opportunity to really contribute here to our community and to the healthcare in our community.
And Nikki, you said it well. We set up our associates for success. We offer training, residency, fellowships, continuing education. We want to connect our associates to the right fit for them so they can progress their career. We want to make sure that we're providing. So what I love most about this place, on top of all the other things I said, is that you can grow within this company. You don't have to leave it to go somewhere else. You have so many opportunities with the 6 hospitals, the hospice, the home health. You don't have to leave our organization to develop and grow, which is not something that's offered in a lot of other major facilities.
Absolutely. And for any international nurse that's watching from their home country right now, the first thought is going to be about the green card. But this opportunity is really so much more than that. And I think that really comes across so clearly from the passion and the care that the leaders and the nurses show at Methodist. Linda, tell us why you wanted to be a nurse in the United States and why you chose Methodist. You're on mute.
I'm sorry. My kids are home. They didn't go to school. Schools are closed today. So.
Okay.
Yeah.
That's okay.
Yeah. So I'm avoiding the background noise. Okay. So when I first came here, my major was not nursing. My major was business administration. That's what I wanted to study. But then I lived in a small community in Indiana that time, and we were surrounded by nursing homes. And getting a job in a nursing home was the most convenient. So I ended up working there as a CNA while I was going to school. But then I got in love with the residents. I loved it. I thought, oh my goodness, I don't think business administration is what I want to do. So I changed my major to nursing. So that's how I got into nursing. So it wasn't part of the plan, but when I started working as a CNA, which is a nursing assistant, I loved the job. So that's how I ended up in nursing. So when I moved down here, I had a couple of hospitals that were willing to hire me. One of them was in California, which Miss Tanya, I had a job offer, but then when I looked at the cost of living and the pay wasn't really adding up. So, and then Methodist came up, and I did a little bit of research and looked at the cost of living, and it's more laid back compared to California, and they have two boys. So I thought, okay, Tennessee would be better. So that's how I ended up here.
Okay, thank you, Linda. Jameson, can you maybe share your experience, why you want to work as a nurse in America, and what you like about Methodist?
Okay, ma'am. So it was my dream of becoming an American nurse ever since I was still in college. So I pursued my American dream. And then if you're a nurse here in America, you have a job stability. That's the most important thing. That's why even though I love Abu Dhabi, I love Dubai, I hate to go, but the job there is not really that stable enough. So I look forward for staying here in America for my family's future. So what I love about being an OR nurse and a nurse here in America is that there are a lot of opportunities. There's tons and tons of opportunities. You just have to choose. And I'm really grateful that I found a Methodist Bonheur Healthcare. I was so amazed, and I'm so grateful that I'm part of this big organization. And they have a very good reputation. They have been consistently being listed as the best hospital here in Memphis area.
Okay, thank you, Jameson. Jill, Nikki spoke about magnet status. Can you talk a little bit more about what magnet entails? Because I think that's really important. For a lot of international nurses, they don't really know that term very well.
Yes, and Nikki can add too as well. But magnet status is really a very specific gold housekeeping seal, so to speak, on performance and how we handle things, the kind of nursing we do, the quality of nursing we do. It's a very high level designation that is hard to obtain, and it takes work from an entire team to make that happen, from the nurses that care all the way to the leadership of nursing. And it's really amazing and a wonderful opportunity to work at a hospital that's magnet designated, as well as a magnet journey, because it makes sure that we're following all the steps required that magnet has set in order to meet that standard.
Okay, thank you, Jill. And I think for everybody watching, just to know, I think only about 8% of hospitals in the whole of the United States have the magnet accreditation, which is like the gold standard. So that is huge. Because that means that, the opportunity is really enormous. Christine, what would you say are the unique attractions about working for the organization?
Unique attractions about working for our organization. I would have to say that our organization does a really good job of finding people that are a good fit for us and that can excel with us, and then helping them to continue to grow and to excel. So we really do a good job, I feel like, setting people up for success, really finding out where strengths are and then finding out where opportunities for growth are. We want to continue to help build those skill sets, and really kind of individualize each person's experience here as far as a professional experience, what they're getting out of working for us. Our goal is obviously great patient care, and safety and quality are always at the foremost. And we really want to help our nurses and our associates here be the best that they can be so that they can provide that great care and that high quality care. So we're really excited about thinking of having international nurses join us. They have such a fabulous perspective. I think we have a lot to offer because we're a faith-based organization, as well as our mission and values that we feel very strongly about. And I think the opportunity to come here and to come into that type of an environment where you know you're going to be supported and you know that you're going to have opportunities to grow and that you're not going to be just kind of treated as one of the crowd. We really look at each of our individuals as they come here so that we can help that person on their journey and find a good home here that they can continue to grow. You've heard that a lot, lots of opportunities, lots of growth things, but really setting people up so that they can take advantage of those opportunities is really one of the things that makes us unique.
Yeah, we mentioned about, we mentioned about Magnet, but our adult hospitals consistently score the highest grades from the National Healthcare Quality and Safety Watchdog, the Leapfrog group. We are the only health system in the region to achieve this designation. So there are many quality standards we're meeting and exceeding that I think is important when you do your journey of looking at the hospital you choose when you're looking at international nursing.
Yeah, lots of awards and accolades, definitely. Nikki, were you going to add something?
Well, one of the things that Christine touched on that I think is really important is we are a faith-based organization. And I know that's something that people who work here really value. And it's part of the diversity here. It's all faiths that are supported. It is not unusual for nurses to pray with one another, to pray with a patient, a transporter, to ask a patient when they're going for a procedure if they want to pray. Again, always being respectful of what a patient needs or a group needs, but allowing that as a component of care. That spiritual component of care is really something that is valued, and it's valued by our patients. It's also valued by our staff. So I think Christine mentioning that, it's one of the things that I love is when a patient is talking about having going to Jameson in the OR, and that the transporter prayed with the patient on the way to the OR, or that the OR staff prayed with the patient because that was comforting to that patient. So it is a spectacular thing. This is the first faith-based organization that I worked in, and it is something that I think is really special. But there's real diversity. It's not, I mean, we do have Methodist in our name, but one of the things here is a lot of focus on diversity, and it's diversity about everything, and religion is one of those things.
Yeah, absolutely. There's a lot of heart in this organization. And, you know, I just wanted to share, I think Nikki is very humble, but I just wanted to share a story of what happened with one of our nurses who arrived. She was a nurse originally from Romania. And of course, there are a lot of nurses from all over the world, but Romania is pretty specific. It was a, you know, they weren't, you know, it wasn't like there were a lot of Filipino nurses or nurses from Africa. It was very specific. And Nikki herself, who's the chief nursing executive of the system, took the time and effort to find Mirela Abadi, who came from Romania. So, you know, I think there's talk and then there's action. And I just wanted to share that story because I think that says a lot about the heart of the organization, for the CNE of the organization to help and to care that much. So I know Nikki's not going to say anything on that because she's very humble, but I wanted to share that story because I think that's important for an international nurse to know that. Okay, we're going to take some questions from the chat. Agban is asking, is the Ielts compulsory for Nigerians? And Agban, yes, the Ielts is compulsory. If you are not trained in English, you need to pass the Ielts exam. The good news with Kinetics USA is that last year, because of the pandemic, we implemented our Ielts Scholarship, and Kinetics is our gift to all nurses who are placed through Kinetics get a free Ielts course. So this is Kinetics pay for that for you. This is our gift for all nurses. And we know the pandemic has been so hard for so many nurses, and this is our way of paying it forward for you.
And I do want to mention, just in terms of diversity, that since the person who asked the question is Nigerian, our president and CEO is Nigerian.
Yes.
Yes.
And so,
Yeah.
and he came as an immigrant and has quite a story of success. But I think it says something about what can happen to somebody. One of the things that, and I heard Jameson say it, Linda, they came here for a better life for their families, and that takes courage, that takes grit, and that's what makes great nurses. So, we absolutely at Methodist admire that, but our president and CEO is an example of that as well. So, so hello to the nurse from Nigeria. We do have some other nurses from Nigeria that work here, and some that are coming. So
I was just going to say some that are on the way, in process. Okay, so Agban is also asking, is there any consideration for nurses that have started their Nclex journey, especially nurses with the AT&T? So Agban, again, please apply to the Kinetics USA website, and our career matchmakers, is what we call our recruiters, are on board to speak to you and to see what you are looking for and how we can help you. Okay. Jennifer is saying, and I'm sorry if I'm not getting to everybody's question, because there's so many questions and so much interest, which we just love. So Jennifer is saying, I have signed an offer from Methodist and waiting for an ID. My friend would like to be in Methodist as well. Is there any chance that they will recruit nurses from the Philippines this year? Jennifer, the answer is yes. Methodists are going to be recruiting more nurses, so your friend is welcome to apply. And in fact, they really encourage everybody to bring your friends, your family, your colleagues, because the community is growing, and the more international nurses that are in the area, the more the more fun the community is going to be, and it'll be much easier to settle as well. Okay, let's see here. Atinji, I hope I'm pronouncing your name right, is saying, I wish to ask how maternity leave works with Methodist. How many months do they give, and are they paid during the leave? Jill, maybe that's a question for you.
Yeah, well, we have a wonderful complement of benefits, and the benefits start the first of the month after you start, so you don't have a long wait period. But there are some requirements by the United States that we have to follow as far as Fmla and maternity leave. So we allow maternity leave, but it all depends on the pay, all depends on how long you have been working with us. But we work with you. We have financial assistance. We have a lot of different opportunities that if there's not pay that we can work and assist with. I just recently had a medical leave unexpectedly, and the support I got through it was amazing. So we definitely do support whatever is needed for you to take care of yourself and your family. But it varies on when you start and when that pays. But we do have an FMLA that's available after a year of employment. That is just normal through the United States. But we have a lot of programs that if you need assistance and financial help during the times when you're out.
Okay,
the
thank
FMLA is Family Medical Leave Act, and it's was the act, the legislation that actually requires employers to support you if you need to be out. So that is a protected right in the United States.
Thank you for clarifying that, Nikki, and for sharing, Jill. So Ma is asking, is there a need for a social security number in order to have my license from New York to be endorsed in Tennessee? Ma, there is, you don't need the social security to get the Tennessee license, but you would, through Kinetics, you have a case specialist who will be able to help you with that process, because it can be a little bit complicated and overwhelming, but you're not alone, and we are there to help you with that. Obanda says, best recruiting company ever. Thank you, Obanda.
We agree.
Okay, so let's talk a little bit about the International Nurse Program. Nikki, why did Methodist decide to recruit internationally educated nurses?
So I mentioned some of that earlier on, is that, we are a very diverse community. And so, when you look at the world now, we are very global. And we are looking for nurses that want to, and other healthcare providers I want to mention, for people who have the same heart that we have, which is putting patients and families at the center of all we do. And we know that the nurses internationally are a good match for that. So that's how we started on this journey, is to say, okay, let's expand what our recruiting efforts are. And that's how we went with the international perspective. What we find with international, and I think you see that in Linda and you see it in Jameson, is our nurses that have a lot of expertise, which is what we're looking for. They have a lot of knowledge. They come to us with passion. But I think just their willingness to relocate to the U.S., and I say this, is shows courage and grit. And that's what it takes to be in healthcare. And so it, for me, is, you talk about the matchmaker, it's a perfect match for us. We are looking for people that match our culture, that share our values, but we want it to be a match for them as well. And that's really part of that whole opportunity piece that we talk about, is how do we help you grow and change? How do we help you get acclimated in the community? So again, and it's not just about you. If you come with a family, how do we help your family get to the right place, to the right community for schools? How do we, Linda lives in the Germantown area, and I think she lives there because of the school system for her two boys. So that's a really important piece, is how do we help your family really grow into this community and acclimate to the community? And because we are diverse, because we have FedEx here, because we have International Paper, St. Jude, and just the diversity at Methodist, it's easy for us to really think about global as the way to recruit. So we are proud. We are thrilled to be able to have this partnership with Kinetics as a mechanism to get us the best and brightest. And for us, it doesn't matter if they're in the United States, or if they're in the Philippines, or if they're in Malawi, or wherever they are. It's really just trying to find the people that match with us and want to grow and change and take care of our patients. So.
Thank you, Nikki. And Christine, can you maybe share, when you are interviewing an international nurse, what do you specifically look for from a clinical perspective?
When we're interviewing for international nurses, we're looking for the knowledge and the skills to be able to provide quality care. We usually do a lot of behavioral-based interview questions, and so we want the nurses to tell us about their experience, to tell us about a situation and how they handled the situation, what they did to resolve something that they were dealing with, and kind of then what the response was. So we're looking to really get to know the people that are interviewing with us, and what they bring to the table. So it's a great method to be able to feel like we understand what people bring to us. We're not looking for perfection. I want to make that clear too. We are looking for nurses that, like Nikki said, want the best for patients and want to give quality care. And so sometimes an answer that you would give us, or when we're talking to you, we want to hear about a mistake you've made, and what you did to correct it, or how you grew from it, because that's what we're about. We really want people to own their practice and to be able to provide that care and to continue growing. Those of us that are nurses know that if we're not learning something new every day, probably there's something wrong, because there's just so much to learn.
So much to learn.
Day. That is right.
Yeah.
We're continuing evolving. We're always doing something and learning how to do something better. And I think that that's really important. So I would be yourself when we interview you, but be prepared to tell us about how you nurse, how you practice, and what's important to you.
Thank you, Christine. I think that's really helpful. And I want to also give a shout out to Don Hudson, who is the Chief Talent Officer at Methodist. He was on a previous show. I think it was a week or two ago. The weeks are just flying. I can't believe we're already in February. And he spoke about the STAR method, right, and how that works. So if anybody didn't see that, please go back and watch that, because I think it's really helpful to actually understand the STAR method and how important that is when you interview with not just Methodist, with the Methodist system, but with any American hospital. Okay, Linda and Jameson, I'd really love to know about your first day with Methodist. Can you share with everybody watching what that was like? Linda, maybe you go first.
So I came in during the pandemic, so things were really different. It wasn't the normal orientation that I expected. The staff, my 6 North staff is awesome. I have a very supportive staff. My manager, Miss Anita, I love her so much. She's really understanding. There was staff-wise, I had no issue at all. It was just the situation itself. So the person that I was supposed to buddy with happened to be she had just resigned, so she was serving her notice, and Miss Anita had already assigned me to her. So our first night was she was like, oh, she's telling me, oh, she's leaving, this is my last night. So it wasn't a proper night, like showing me stuff, and they were short staffed, which is everywhere now. I mean, I always tell people it doesn't matter where you go. I've had friends that have left Methodist, have gone somewhere else, and I talk to them and they tell me the same story. Oh, we're short staffed. So I think it's just it's everywhere. So my first night was a bit bumpy, not what I expected, because we were short staffed, and she was the team leader, and she had me as a buddy. But so I told her, I mean, after like 2 hours, I told her, okay, I don't know about the documentation part, but I know the basic nursing care. It's same everywhere. So that I can do. If you want me to go and do my assessment and do ABCD, so that I take off the load off her shoulder, because she had so much, and me following her, plus everybody else calling her as a team leader. So that was my first night. And then I had a second 2 nights. And that was last night. She had left. So then I was buddied with another one for the next 2 weeks, and she got sick from COVID, and she didn't come back. And the other 2 weeks, so it was different people. But that's the beauty of knowing your story. So if you are experienced already, nursing is the same everywhere you go. It's the basic nursing. It's actually the same. It was mainly the paperwork, the documentation that I was not used to, but Miss Anita was very accommodating. So she gave me extra days. I was allowed to go and do the chatting, which is the computer chatting that I was not aware of. So I went and I did, I think, 2 extra days on the computer chatting. That was it. But yeah, my orientation was not the normal orientation because of the pandemic. But otherwise, the staff were really supportive. Like I would ask a question, everybody was willing to help. I didn't have issues. I've always believed in you better ask and look stupid, or you make a mistake and really you become stupid. So I would always ask, and I never had issues with the staff at all. I mean, everybody was willing to help, to answer, despite the short staff and our busy schedule. But yeah, I pulled through.
Okay, good, Linda. So it's and I think it's important for you to share that right now many hospitals have gone through enormous crises that they've never experienced before, and there is a shortage of staff.
Yeah,
But
sure.
I think the message that comes through is that even if it can be a little bumpy, I mean, we hope that it's not going to be bumpy, and yours was right kind of smack in the very beginning of the pandemic when you started.
Yeah.
But there is so much support. You spoke about your manager being so accommodating. You love her, and the extra time that you're given. So, I think that's really important to highlight. Jameson, can you maybe share with us what you like about working for Methodist?
Well, I'm so impressed with the operating room setup. I've never seen an operating room so big and so wide as what this university has. We have the 24 total of operating rooms, and it's really big. During my first week working with them, I got lost. I got lost trying to find my way through the hospital. So I need to clock in as early as possible because I don't know where to go. I rode the wrong lift. And then I went through the wrong door. So it's like a maze. It's really a maze. I've never seen a recovery room with as much as 40 bed capacity, if I'm not mistaken. It's really big hospital, and I really love the complexities of the surgeries. Is they have we cater transplants, heart surgeries, neurosciences, urology, and all that good stuff. And I've been dealing with a lot of people, of different accents. I'm really adjusted with the southern accent, and I still am working with it. But I really love it. It's
You
a good
love
place
it.
to work.
Oh, I love that, Jameson. Jill, do you want to maybe talk about, there's a cool story about, and Jameson was talking about the OR and the transplants. Do you want to share the story about Steve Jobs and Methodist? I think that's a really cool story for people to know.
Yes, most people don't know that Steve Jobs actually came here and had his liver surgery here. He searched and looked for the best of the best and the brightest. And Steve Jobs, as you know, has the money and the ability when he was alive to go anywhere, and he chose here to get his surgery done. So that speaks volumes to the quality of what we do and the research that we do. It's not just that we're on cutting edge. We research. I mean, we're innovative. We are constantly trying to think of better and newer ways to do things. So if you want to continuously learn, this is the place you want to be, because we're always creating some new milestones that we not only succeed, but beat.
Yeah, absolutely. And the fact that Steve Jobs was probably one of the richest men in the world at that time, chose this hospital for his own transplant. It really, I mean, that just speaks volumes. So certainly something that's really cool about the history of the organization.
So just for everybody to know, Steve Jobs was the CEO of Apple and was the developer of the Apple phone, the Apple computer. Some people out there might not even know who he is.
You're right, Nikki. So yes, that
I
is
didn't think
true.
about that, Nikki, but you've got a point. Yeah, I
You've
wouldn't.
got a point. I was just thinking everybody would know, but thank you for
very
mentioning that.
international company. So maybe everybody does. You can put in the chat if you knew who he was. Again, he did choose Methodist, and his family and the foundation continue to be involved in Methodist. One of our units, our transplant unit, actually uses Apple products.
Yes.
So it's it is a cool story. And we're not breaking HIPAA because it's in a book.
Correct.
I think we all use Apple phones now, because we also, even us, not just the transplant, we're using Apple phones. So it's the whole hospital.
Exactly.
Thank you, Linda. Jameson, can you talk? And we are almost at time. I'm like, oh my God, I've got so many questions we still need to get to. We might go slightly over time, so everybody just bear with us. And there's so much to talk about. Jameson, can you talk a little bit about the community when you arrived at Methodist? I know that you had contact from other nurses and the nurse associations. Can you talk a little bit about the welcome that you received?
Well, I am so lucky that we have a strong Filipino community here in Memphis, and I found them through Lifora and through Connectics as well. They introduced us to the Philippine Nurse Association of Tennessee. I met the former president and the current president, and then they've been very welcoming to me. They gone the extra mile. They even drove me to and going to the grocery stores, going to the social security offices, going to the bank. And they've been very, very nice, and we ended up as good friends. So I really salute you guys through the Refora group and on Facebook. Keep up the good work. Thank you for all your help, for making our American dream possible.
Thank you, Jameson. We spoke a little bit about the training, and I just want to show a video by Jennifer Fulk. It's a very short video just about how Methodists have approached the onboarding and training of internationally educated nurses. So we're going to just show that.
International nurses, we'd like to welcome you to Methodist as part of being a full-blown associate. You are eligible for all of our clinical education that we offer: critical care, med-surg, neuro, American Heart Association. We do offer courses to help you get assimilated to some of the areas that you're going to be working in, so you're more comfortable doing that very crucial patient care for your patients at bedside.
And thank you to Jennifer for sharing some background about the education piece. Linda, you mentioned the electronic medical records was one of the biggest differences that you experienced. Was there anything else from a clinical perspective that was a big difference, or something that you want to highlight to all the nurses that are watching, or what to expect?
Especially nurses coming from Africa, I would recommend they get their computer skills up to date, because it's paperless. I went to school here, but the time I was here, we were still, the only fancy thing we had then was the Pyxis. The Pyxis, getting your medication from a Pyxis, but everything else was still, we're still writing down, but now it's gone paperless. So you can go in 12 hours without writing anything, without using a pen. So I would recommend, I always tell my friends that are trying to get here that make sure you get a computer course, make sure you get familiar with your computer, because that was what took me time, was
the
to
biggest
get
challenge.
Yeah, and like the Jameson that came from Middle East, I think they were using the same system, so it was easy for them to adjust. But with me, it took me a while. Despite being a fast learner, I still struggled a bit. So that's what I always tell people, is to get their computer skills up to date. But otherwise, it's a very great place to work. As I said, there's the nurses, the management is very supportive. So yeah, I'm glad I'm here.
Oh, well, we're glad
you're here.
Thank you.
And Tanya, one of the things I love what Linda said is when and Christine talked about it being individualized, when she needed more help with the electronic medical record, she got that. And so again, that's part of in the interview process, what we're trying to find out: what is your skill level, how do we individualize this? So again, that is something that we will work with you on, and
exactly.
Even some of the nurses in the United States struggle with that, and so we're well aware of what it is that we need to assess and how we help people to do that. By the time, Linda's probably a whiz at it now. It's first, but you learn it because you do it so much, right, Linda?
Oh yeah, sure. It's much better. I mean, I don't have to struggle reading doctors' prescription and trying to come up with what medication is it writing about. I mean, it's exactly all clear. So less medication errors. I mean, I mean, for you to make a medication error, you have to be really sleeping, because the computer will prompt you before you give it. When you scan the patient, the computer prompts you. Are you sure you're gonna do this? And they ask you twice. So for you to make a medication error, you have to really be sleepy or some. But otherwise, it has made life much easier.
Okay, good. So it's a transition, and that's good advice, Linda, to those people who are not working with a computerized system yet, is to brush up on those skills, because that is going to be a challenge, and it is going to be something to adapt to. Jameson, and I apologize, everybody, we're going to run a little bit over time, but I think there's just so much to cover. I don't want to leave anything out. Jameson, can you maybe share what your training was like, when your orientation and training was like when you came to the hospital?
So when I came to the hospital, I got a mandatory 2 weeks of orientation from the facility orientation, and then after that, we have a good training system here in the operating room. We have OR educators, and then they pick me up from the room, and then they turned me around. I was so overwhelmed with how big the whole OR is, and then for the specifics of the orientation, I got a preceptor. They've trained me per week. Like for this week, in this particular week, I'll be assigned to do general surgery cases, and then the week after would be like for the neuro cases and so on and so forth. So it was really good. They have the tools, the checklist for we focus on the goals that I need to attain. And then it was really I was also lucky that I have a quite few Filipino OR nurses are working here. We're a total of 7 nurses, and I'm so lucky that they've been adapting so well, and I'm so impressed with them. And what I really love about working with Methodist University operating room department is that the help is always available. We have the PCCs, the patient care coordinator. They're the person who's responsible looking after their specialty. So we have all the help that I can get, and I've never experienced being left out. I feel always at home. They always help me every time that I don't know what to do. They're just one call away. So I'm really impressed and really glad that I'm here.
Wow, Jameson, I love that. And the word that keeps coming through is support, So we just love that, because it is a challenge for an international nurse. There is going to be a transition period, but setting you up for success is so important to the leadership, and it just filters through the whole organization. We're going to finish off now by just talking about career growth opportunities and about the wellness program. And we've got a short video as well, just to share with everybody from Becky Chamberlain. Which talks about the well-being program.
Everyone, I'm so excited to speak with you all today to tell you about our well-being program that we have here at Methodist Bonheur Healthcare. Our well-being program is called My Healthy Life, and we have so many resources that are available to you and all of your dependents for free. Everything from yoga to kickboxing to Zumba. We also have many mental health resources. We have our priority is your health and well-being, and we want to make sure that you're at your best so that you can serve our patients in the best way possible.
Well, thank you to Becky for that. So it's not just on the clinical side, there's a holistic well-being program at this organization. And there's also the fellowship programs, nurse residency programs, which we were going to spend a bit more time on, but we kind of running out of time. So I think I'm just going to hand over to Nikki for the kind of final words, just to talk about, why Methodist. And I see we're getting a lot of people asking questions about other job types. Shannon's asking about EMTs. I think there was a question about med techs, about nurse aides. So Nikki, do you want to maybe just kind of finish off and address those questions?
Yeah. So thank you, and I'm going to ask Jill to join in.
Sure.
One of our values is team, and I think you heard Linda and Jameson talk a lot about that, is that we work on a bigger team to care for the patients and to provide that quality, safe care. And that means that we do have opportunities for people with other professions that we are interested in recruiting. We just introduced, for example, for paramedics and EMT, a program in our emergency department where there's a progression. So there's 3 levels now.
Yeah.
So that you can really grow within that position. And one of the things that we are looking at is how would we recruit internationally for people who in what we're calling patient care assistant positions. And it's really 2 things. One is maybe somebody who hasn't taken their Nclex and wants to come to the United States and wants to work and prepare for the Nclex while they're here. And Methodist could support that by you getting a job here but also help you with that development piece. Or if you have a family member, perhaps that wants to come with you. One of the things we really haven't talked about is that Methodist we talked about what we do internally, but we also support education externally. So we have a tuition program where we will pay your tuition to help you go back and get another degree or to advance your education in a certification. We have a program that's called MAP, and I'm going to ask Jill to talk about MAP, because that would absolutely be a program that perhaps a PCA, a patient care assistant, might come to the United States and take as a benefit and advance to being a nurse or a respiratory therapist or surge tech.
Yes, and we call it the MAP program, and that's just our Methodist Advancement Program. And what it is we actually work in tandem with the local colleges to allow you to be trained up in another specialty area while you work at Methodist. So to Nikki's point, a CNA can become a surgical tech, and we train them to be a surgical tech. And we're currently having our first class graduate. And of the 16 students, we have secured all of them jobs if they wanted them. So it allows them to grow professionally, allows them to continue their career path, but it also allows them to make a more financial impact for their family because it's a higher paying job. So we're looking at expanding those programs and adding more aspects to that program. But absolutely, if your family member comes and can be part of that, we would love for them to be part of the program and allow them to continue to grow their career. So there's many ways, if you really want to develop at Methodist, you can, both professionally, personally, and socioeconomically, which is something that I've never seen anywhere else.
Thank you, Jill. Well, on that note, we're going to be finishing off, and I'm just going to read out the message from Priscilla, who's saying, congrats to the Methodist team. And I'm so happy to start a new history in my life with you. So
we're looking forward to seeing you.
Yes.
And that's what we want for everybody who's watching. I think as we draw to the end of this show, we went a little over time, but I think it was so worth it. There are so many comments in the chat. There's so much interest. This is just the most phenomenal organization. I think everybody can see this is not just about the green card for international nurses. This is about opportunity to better your life, like Linda and Jameson, opportunity to contribute, and to contribute in an organization that has heart and is supportive of you and wants to set you up for success. So I want to thank the Methodist team for joining us today. This was such fun. And I want to finish off with just some information about upcoming shows. So we have some upcoming shows for the month of every week. Onwards and Upwards is on. This is free information for internationally educated nurses that want to come to America. On the 11th, we have our illegal expert panel that will be here to answer your immigration questions. On the 15th, we'll be hosting the Lafora Talk Show, and we'll be talking about tax season. It's all about taxes. So you're going to learn about how to file your taxes in the United States. On the 18th, we'll be showcasing Stateside, which is talking about what it's like to live in North or South Dakota. And on the 21st, we're going to be doing Ielts with Swish English. And Kinetics Initiatives as well is obviously our free Ielts Scholarship. The Nclex Scholarship, we're going to be announcing the winner in two seconds. And we have great news. We extended our $1,000 referral fee for nurses with Nclex until the end of February. We also have our podcast, Nursing in America. We're in the top 10% of podcasts worldwide. We have our Direct Hire Nurse Aid program, our Onwards and Upwards shows. And as the Methodist team, we have many, many needs in all the allied areas as well. So finishing off with our winner for the Nclex Scholarship. Drum roll, it is Mark Anthony Tumandong. I hope I got that right.
Congratulations.
The cost of your exam. So congrats to Mark Anthony. With that, we're going to finish off today. I want to thank the Methodist panel. This has been such a fun, informative discussion, and I hope has inspired so many international nurses all over the world. The chat is going crazy, and we will try and answer as many of your questions as we can after the show. But thank you for joining us today, and as we always say, onwards and upwards. Thank you,
Wonderful.
everybody.
Thank you so
Bye.
much. It was fun.